Right, I think we'll go ahead and get started. We will be recording this presentation so we can use it for future use and education. So I want to welcome everybody. My name is Stephanie Freeman. I am the Memory Center Program Coordinator here at Norton Neuroscience Institute. An honor to be here as usual. This is something we do twice a year. It's a 3-part series, and we try to find topics that really could be informational, educational to support you in your journey as a caregiver. And a question we get quite often is, as a caregiver, what is my risk of developing dementia? Whether that's because of a genetic component or just in general, the burden and stress that you all might face. What does that look like? So we wanted to tackle that as well as we could. And so we've brought some experts with us today. I want to point out too, there's a chat option and a Q&A option at the bottom of your screen. So we want to utilize that Q&A tabs for questions for each of the presenters today. So we will address those at the end of today's presentation. So feel free, any questions that you have for our provider, Jessica Cain, or for the Alzheimer's Association, Aaron, who's with us, please put that and we will get those answered live on here towards the end. So I want to introduce a fantastic community partner we have, the Alzheimer's Association. Aaron Gillespie is the program manager for the chapter for the Kentucky, Indiana chapter of the Alzheimer's Association. Just a great depth and breadth of resources for you for education and support. And to highlight those, please help me welcome Aaron.
Thank you, Stephanie. I appreciate it. And I'm going to go ahead and share my screen. Do you all see that? Good?
Yes.
All right.
Looks great.
Okay, perfect. All right, so as Stephanie said, I am Aaron Gillespie. I am the Director of Programs for Greater Kentucky and Southern Indiana Alzheimer's Chapter. We cover 125 counties throughout Kentucky and Southern Indiana. And today we're just going to review some of the facts and figures that just was released in March, and also some information about who's affected, how this disease impacts our community, and what is happening to our caregivers in the community as well. So I'll start with our facts and figures. This, like I said, this was just released in March. The Alzheimer's Association releases a facts and figures report every year with a special report in addition to this. This year, the special report was about caregiving and care navigation through our health systems. So you can see here, these facts and figures are in-depth look at the latest statistics on Alzheimer's disease prevalence, mortality, caregiving, and cost of care. Another thing that comes out in March in tandem with our facts and figures is a national statistic and overlook of our communities. And then we do put those into our states. We gather information about our state statistics, and you can see here in Kentucky alone, over 80,000 people 65 and older are affected by Alzheimer's disease, which is about 10% of our population. You'll see in my next slide too that some counties obviously have a higher statistic and higher rate of Alzheimer's. I do want to point out, I'm not going to read all these statistics to you, but I do want to point out that you can see that 65%, over 65% of caregivers have a chronic illness, and almost 40% say that they struggle with depression. I don't say this to alarm you, but I do want you to know the facts, because as we go through some of this presentation, and I'm sure Jessica will talk about it as well, there are supports and resources that can help you through this journey. And so, we don't want you to be part of that statistic. We want to give you the resources and information to keep you from that. So again, I won't read over all of this, but you can see how the numbers are so staggering in Kentucky and nationwide. This is just, we call it a heat map of what Alzheimer's looks like in Kentucky. Last year at our AAIC, which is the Alzheimer's Association International Conference, people come from all over the globe, bringing their research and their information to their colleagues, like I said, across the world. One thing that came from AAIC is a statistic of by county, how many people are affected by Alzheimer's. And I will note that this is only Alzheimer's disease, not other dementias. And so we've never had this information before. We know statistically about how many people are diagnosed. And I will also point out that the word is diagnosed when you talk about those numbers I just talked about in Kentucky and also with this heat map. A lot of people we know go undiagnosed, and especially in rural communities and diverse communities. But this just shows you a little bit about how people are affected in Kentucky. Without further advancements in treatments, it's estimated that Americans 65 and older, the prevalence will double by 2060. So who's impacted by Alzheimer's? We talk about this a lot. Impacted by Alzheimer's doesn't mean you're necessarily the one diagnosed. We know everyone in the family, if there is a diagnosis or some kind of cognitive decline, it's all hands on deck. Everyone is impacted. Obviously, the aging population is the most at risk. We're seeing a lot of sandwich generation. Um, what I mean by sandwich generation is that a person has a aging child at home and also an aging parent. This increases the stress of the caregiver because now you're not only taking care of one person, you're taking care of multiples. The U.S. workforce, we talk to people, a lot of companies, and sometimes they look at us like, people are still working. Why do I need to know about Alzheimer's disease? Why do they need to know? Well, we do know that caregivers end up coming in late. They retire early. They may go down to part-time. So not only are you affected at home, but all of our workforces are affected as well. Women, we'll talk a little bit about that in a minute. Millennials, Black and Hispanics, Black individuals are twice as likely to get a diagnosis of dementia or Alzheimer's than their counterparts white. And then also Hispanics are 1.5 times more likely. And then our LGBTQ community, because we do see historically that they don't have the supports that maybe other families do. So who are our dementia caregivers? There was I had a conversation with someone talking about what is a caregiver. And I think it's important to really define a caregiver. It doesn't mean that you're 24/7. It doesn't mean that you're paid. Even if you go to your loved one's home, if they're still semi-independent, but you're going in to get them groceries a few times a week, check their medicines, that is being a caregiver. 2/3 of caregiver are women, and 1/3 are daughters. And it's funny that we see this. We do know that a high percentage, like I said, 2/3 of caregiver are women, but also 2/3 of women are people diagnosed with Alzheimer's are women. So over 60%. There's 11 million women living in the United States that are either diagnosed with the disease or are a caregiver. About 1 in 3 caregivers are 65 and older. Over half of primary caregivers take care of their parents. And this is another reason we talk about, 10 warning signs and general disease education to all spans of life. We talk to teenagers, we talk to people in their 20s and their 30s, because unfortunately, we do know that they will be affected in some manner. And then also 66% live in the care recipient in their community. So there are unique challenges for our dementia caregivers. Dementia, the cost is twice the average of out-of-pocket costs for caregiving for dementia caregivers. 30 to 40% of dementia caregivers experience depression. We saw that statistic in Kentucky. We are on that higher end. As you noticed, it was about 39%, a little over 39%. 44% of caregivers have anxiety. And then women are more likely to experience the stress of caregiving. There's different challenges as being a woman, but also we see that there are more women caregivers. So what is the importance of managing your stress? We know that caregiving, it's an important job, but it's a taxing job. And so we do see that, like we saw in the last slide, that there are high levels of stress. A lot of times, you're not going to the doctor like you should because you're taking someone else to the doctor. You're not getting out and exercising. And, there's a lot that comes with a diagnosis of Alzheimer's. There's a lot of learning, there's a lot to do, and this only increases the stress. So we do encourage you to look at the signs, if you are signs of caregiver stress. This will include denial of the disease. We see this a lot, especially when you first get that diagnosis. Anger, social withdrawal, anxiety and depression, sleeplessness, lack of concentration, health problems that take more of a mental and physical toll on yourself. So we're talking about caregiver stress. We do have 10 symptoms of caregiver stress on our website, and I'll give you some more information about our website. It is a wealth of knowledge on our website. Sometimes it can be challenging to find what you need because there is so much, but I will give you a direct link here in a few minutes. But I did want to point out this page specifically. This is for our caregivers. How do I know that I'm stressed? Maybe I don't sleep well anyway, right? So if I have a sleepless night and it continues, is that just because I don't sleep well, or is it because I'm stressed because the things that are going on, navigating, being a caregiver? Anger, social withdrawal, all these things we just talked about, but it does give you more of information about what does that denial look like? What does anger mean? Obviously as a caregiver, we get a little aggravated because the disease is tough, and we know that there's repetition, there's forgetfulness. And for someone without cognitive decline, it can be a little aggravating and frustrating. So, we know that there's normal agitation, but there's also anger and things that can be helped to reduce your stress. And you'll see over here, there is a caregiver stress check, which is great. I've sent this to many families in the past. If you don't know what depression is, there is information about caregiver depression, changes in your relationship, and grief and loss about the disease progression. We know that there's grief. There's grief throughout this journey. So understanding what that is so you can identify it is very important. So tips to manage caregiver stress. We know that no one is stress-free. That would be, the ideal world. But there are things to help you through this. Our Alzheimer's Association 24/7 helpline, I talk about this constantly. It's available day or night. It is manned by clinicians, master level clinicians. There's over 200 languages. So if English is not your first language, you can call this number and speak your native language, which is very important, especially when it comes to understanding and getting correct information. But you can call this number. It's not, somebody asked me one time, is this just for emergencies? Absolutely not. You can call this number if it's 11 o'clock at night and you're just now putting your loved one or your partner to bed and you just had a really bad day. You need someone to talk to. You can call this number. If you're looking for a support group in your area, to really be around people that get it, you can call this number. If your loved one my grandmother, when I was caregiving, she hated taking showers. It was confusing for her. At that time, I didn't know like how to handle those things. Sometimes I would just wash her hair in the tub, but if you're having these challenges, there's help out there. And I really wish I would have known then what I know now. And so you can call this number. They can give you tips and strategies to manage some of these behaviors and techniques to combat some of the challenges that you may have. I can't talk about this more, is taking care of yourself. Don't skip your doctor's appointments. Ask for help. There is respite services out there. There are adult day centers. Ask your family. We know that a lot of people, someone will be like, "Oh, can I help in any way?" Start saying yes. Like I said, go to the doctor regularly. Take a lap around your neighborhood or go to your local Y. Eat well. This will be very helpful. And learn some relaxation techniques. There's all kinds of things on YouTube to learn about how to breathe, how to relax, how to meditate. This can be very helpful for your mental and physical health. And like I was talking about, take a break for yourself. Go have that coffee with your friends. Go to the movie, go outside and garden. It's very important that you still find those little nuggets that give you joy, and that you can take a break for yourself and just be who you want to be. And then also like making sure that your loved one is safe. It is okay again to ask your family for help if you don't have family that are live near you or able to. Again, there are respite services, and I'll show you a website on where to look for those. And when I say respite services, it's someone that comes into your home. I know sometimes we use jargon that's in our space, but if you're new to this space, respite is when you have a professional that comes into your home that can sit with your loved one, play games with them. It is not home health. It's not a healthcare service or a health service. So here's with the Alzheimer's Association, we do have a lot of resources that I do encourage you to take advantage of. Like I said, when I was a caregiver for my grandmother, I didn't know all these things were available. And we see people every day that use these resources and come to us and say, "Thank you so much," because it really can be a game changer. Again, our 24/7 helpline. We do have 29 support groups throughout the state of Kentucky and Southern Indiana. Those are in person, and then we do have some virtual. We know that sometimes it's tough to get out as a caregiver. So we do offer some of those virtual as well. We have education programs. I'll talk about those a little bit here in a few minutes. Early stage programs, we know that it's important. We have early stage support groups. We know it's important that when you first get the diagnosis, like we talked about earlier, it can be challenging. We know that there's anger, denial, and you really just want to be around people that understand this very first stage. There's a lot of learning that comes along with this early stage and right when you get this diagnosis. So we do have an early stage support group, and there's one in Lexington and Louisville, and it's very unique because the care partner comes to the care partner and the person living with the disease come together. Everyone socializes and then they break off into two different groups. We know it's important that the people living with the disease have their own group, and then also the person, the care partner has their group. That way you can talk freely, you can talk about what's going on that maybe you don't want to talk about in front of your loved one. Things that are going on personally that maybe someone sitting beside you has went through. I can't talk enough about our support groups. I know sometimes people are a little hesitant to join a support group because you feel like you got to share everything. I say that our support groups are also an excellent education and resource avenue. All of our support group leaders and our education facilitators are trained by the Alzheimer's Association, and many of them are past caregivers or work in the dementia aging space. So they have a wealth of knowledge, but so is that person sitting beside you because, you know, when we say one person with dementia is one person with dementia, but some of the challenges in the navigating the health systems or diagnoses um, can be um, can be the same or very similar. And also, one resource might have worked for somebody beside you, and you had a different resource. And so, sharing those things are very important. And also, you can help support your community in those ways as well. We do physician outreach. We know it's important, especially with primary care physicians, that we try to give them as much information and our resources as possible because a lot of times that is the first point of entry. We also have a caregiver center that I'll talk about here in a few minutes. And then we also have opportunities for those working with individuals and caregivers for professional development and resources that they can provide their clients and patients. So I do know that this slide is super busy, but I know Stephanie and them do a great job of sending these resources out after the program. So I'll just talk about a couple of these, especially our alz.org/KYIN. This is where you can find all of our calendars for upcoming programs and support groups. And then also we house all the information that um, the national level does. You can find caregiving tips. You can find a recently diagnosed. If you have questions, there's information on there about that. The second thing I want to point out is our community resource finder. It's alz.org/CRF. This is a comprehensive database for local dementia and aging related resources. You can find anything from a diagnostic center to a respite service. Or if you're looking for a support group or education program, you can look on the CRF. And the good thing about this resource is that everything is you can look up via zip code. So if you live on the east end of Louisville, you can find something closer to you. If you're starting to see some differences in your loved one when you're talking to your mother or your uncle or your aunt in Florida, and you're like, "Ooh, I'm starting to see maybe some issues. Who should I contact? I don't live there." You can look up resources anywhere in the nation by zip code. So our caregiver support, again, this is a very helpful website. It goes anywhere from what to expect through the different stages of the disease, how to get support, daily care for you and for the caregiver and for the person living with the disease, care options and planning. This is very, very important. I can't express enough how the planning is important, especially in those early stages and in that diagnosis. You want your loved one part of what their future looks like. And it also, once they get to those middle to late stages, it's proven that it reduces stress for the caregiver and the family if you are making these plans sooner than later. Our publications, this is a hidden gem in my book, is that these are all printable PDFs. So if you have family members that you just got diagnosed or you're going into the middle stage and your family members don't know how to communicate or they don't know much about what's going on with your loved one, all these are printable PDFs. So you can share with your physicians, you can share with your families, your neighbors, and you can get anything about what is the disease, how it is affecting the brain, down to safety or activities at home. And so, again, there's over 100 PDFs on here. Anything you can think of can be found on our publications website. Earlier, I was talking about our support groups in the Louisville area. I know probably not everyone is on this call that's in Louisville. If not, again, you can use the CRF to find a support group close to you. But in Louisville, we do have 7 support groups all the way from the east end of Louisville to the west end of Louisville. We also know that caregiving looks different depending on your relationship with the loved one. And so we know that spouses go through a different journey than maybe a daughter or a son does. And so we started a spouse partner specific support group that is virtual. So anyone, no matter where you're at, you can join this group. It's very, very successful, and it is led by a trained therapist. That is her day job. And so just a really, really great group if you're interested. So here are some of the programs that we do offer at the Alzheimer's Association. We do anything from the general 10 warning signs if you're starting to see some differences in your loved one, to really understanding the disease. We know that caregivers, even if you get that diagnosis of dementia or if it's a specific diagnosis of Alzheimer's, not always does that mean that you understand what the disease does, and then some of the things that some of those behaviors and communication and things that are going to go along with as your loved one progresses. And so it's important to know the basics and the really the hallmarks of the disease in order to be able to understand how to navigate the disease moving forward. We also, like I was talking about, we have a managing money, a caregiver's guide to finances. Figuring those things out right now is going to help you mentally, physically, and also making sure your loved one is part of those plans in the future. And then one I will highlight is this is a brand new program for our organization. It's called the Empowered Caregiver. It's a person-centered approach to focus on individuals and their specific needs. It involves, it had 400 caregivers through this pilot phase of these modules and this series. So this isn't someone sitting in their office and like, well, this sounds good. I read this in a book. I think this should work. This is powered by 400 caregivers that looked over this and was like, and really gave their feedback on the topics, the content. And so it also includes putting into practice. So these modules aren't just talking at you, it's talking with you and getting you engaged. And it also sends you home with an activity to implement in your home. I would be remiss if I didn't talk about our Walk to End Alzheimer's. The reason that I started, when I was a caregiver for my grandmother after she passed, it was very hard for our family. And I heard about the Walk to End Alzheimer's. I'd always heard about the walks and research, and so I really wanted a way to celebrate my grandmother. This disease isn't always full of celebrations, and so I felt like that was very important to be able to celebrate who she was as a person, all those things that we laughed about, even when we were caregivers. And I mean, she could be spicy sometimes. So, it's time. It was an opportunity. We made shirts. My family came in from all across the state. And we made banners and posters. And so this was really my initial contact with the organization, and just seeing how many people were around us that really understood what we went through, and really being around all the smiles and the laughter. I mean, it's just encouraging, and it just gave us a great way to look at my grandmother in the way she was and not her diagnosis. And so a lot of times this is the first entry point for volunteers and also for families. It's just an incredible experience, but also it's a great way to get resources. We have so many community partners at our walks and that have tables and they're all in one place. They're there that day. You don't have to call 10 people. You don't have to look on the internet. You can talk to them in person. So if you are interested, you can go to alz.org, and there is a walk website. I'm sorry. So finally, I did want to make sure that everyone knew that we do have one more portion of this series coming up in June. It'll be June 13th, and it will be breaking down the stages of dementia, early, middle, and late stages. So if you haven't yet, please go ahead and sign up for that. And we look forward to seeing you there. And next, I am going to introduce Jessica Cain, who is a physician assistant with the Norton Neuroscience Memory Center, specializing in memory disorder. She has a practice with Norton in Frankfurt as well as Norton Brownsboro campus. So welcome, Jessica. I was so glad to see you here today.
I am so happy to be here. Thanks for having me. So today I'll be talking about examining a caregiver's risk for developing dementia. Can you all, sorry, before I start, can you all see my screen?
Yeah, it looks good.
Okay, perfect. All right, fabulous. Let me figure out on my end. Okay, so as an outline of this talk, I'll begin with some general background, discussing the spectrum of cognition and thinking from from normal to abnormal. We'll then talk through various risk factors for developing a dementia with a focus on the modifiable risk factors. After that, we'll discuss various prevention strategies, including proven prevention strategy, the finger model. So again, this slide is mainly for background, as it's useful to go over a couple of definitions to make sure we're all on the same page. We often consider cognition as a spectrum from normal to impaired, and this is especially true with age, when the spectrum of normal cognition can become increasingly wide. So you have successful aging, where there's really no cognitive change that's noticed with aging. You feel like your brain was just like it was when you're like 18, for instance. That's pretty rare. You have usual aging, where the person will notice some minor cognitive changes that are typically associated with aging. Examples of that include you might walk into a room and forget what you went for. You may be in the middle of a sentence talking and kind of not be able to think of the right word or name of a person, but those are pretty minor changes. You also have cognitively impaired aging, mild cognitive impairment, and dementia. Mild cognitive impairment is a fancy term, simply means that the person is having impairment in one or more areas of cognition and thinking. So they may have some difficulties in memory, language, attention, or concentration, as well as executive functioning or planning. But they're not having any significant impact on the daily living. So they're able to manage their medications, manage their finances, things like that they were able to do before without any issue. There is dementia, which is an umbrella term that means that the person is having impairments in multiple areas of memory and thinking. And this is having a significant impact on day-to-day functioning. So they're not able to manage those medications on their own, their finances, etc. I just have this slide on here mainly to give some perspective. We kind of think of, I often get the question, what's the difference between Alzheimer's disease and dementia? Dementia is this umbrella term, like I just mentioned, that describes these impairments. Alzheimer's disease is the most common cause of dementia, but as you can see with this list, there are many different causes. Today, we'll primarily focus on Alzheimer's disease, but I just wanted to throw that slide in there for some perspective. So next, we'll kind of talk through risk factors for dementia. This kind of fall into two different categories. So you have the non-modifiable risk factors. These cannot be controlled or changed. It's kind of the lot that we've been dealt in life. Then you have the modifiable risk factors. These can be controlled or changed. So the non-modifiable risk factors, you have age, you have family history, genetics, race, gender, caregiving, question mark. We'll talk through that a little bit more and try to answer that question as best we can today. So age, this is the greatest risk factor. The vast majority of people who
Jessica.
develop,
I'm sorry to interrupt. Are you meaning to advance your slides?
yes, I'm so sorry.
Okay.
That would be helpful when I'm like, all of these dementias that I'm listing. I'm so sorry, guys.
That's okay.
These are, so kind of going back, these are the various causes of dementia. So let's see, we've got these non-modifiable risk factors and the modifiable risk factors. So to go back, so age, this is the greatest risk factor. The vast majority of people who develop Alzheimer's disease, again, are over the age of 65. But I want to add that aging alone is not sufficient enough to cause Alzheimer's disease. Let me see if it, okay, perfect. You have family history. Individuals who have a first-degree relative with Alzheimer's disease are more likely to develop the disease than those who do not. And those, who have multiple family members, are at an even higher risk. And when we're talking about first degree relative, I really mean parent or sibling. Let's see here. Then we have genetics. Researchers have found that many genes, up to 31 different genes, can increase or decrease the risk of Alzheimer's disease. 1% or less of the population will develop the disease as a result of gene mutation. That's the autosomal dominant Alzheimer's disease. That's extremely rare. We think of race. In the US, and Erin she mentioned this and did a great job, but in the US, most prevalent studies indicate that Black older adults are about twice as likely to have dementia than white older adults. And there's a similar prevalence among Hispanic older adults. So research suggests that the historic and continued marginalization of Black and Hispanic people in the US has produced disparities between Black older and Black older and Hispanic populations and older white populations in life experiences, socioeconomic indicators, and ultimately health conditions. We really need to be doing better when it comes to health equity. Gender. Women are at a higher risk of developing dementia. 2/3 of Americans with Alzheimer's disease are women. A theory for this is that women tend to live longer than men on average, and older age is the greatest risk factor for Alzheimer's disease. The survival difference contributes to higher prevalence of dementias in women compared to men. So we get to risk among caregivers. We know that there are benefits to caregiving. You can develop, a deeper relationship with the person that you're caregiving for. It's incredibly fulfilling. You're, as a caregiver, learning and developing new skills. But we also know it can negatively impact a caregiver's physical and mental health. And I just want to define what a caregiver is. An unpaid caregiver is defined as helping with personal care tasks like helping administer medications, feeding, dressing, bathing, as well as helping with household tasks like cleaning, managing money, preparing meals. Caregivers take on a variety of roles, and some perform medical tasks with little to no training. Unfortunately, little is known about caregivers' cognitive decline, and this is especially unfortunate because approximately 20% of US adults, or 1/5 of US adults, are unpaid caregivers. And a stat that I ran across, maybe in the Facts and Figures from the Alzheimer's Association, was of people who are not currently caregivers, 1 in 6 expect to become caregivers in the next 2 years. Which I found was pretty staggering. So this is a demographic, just of who caregivers are. I think, Aaron, you covered a lot of this pretty well. Like you mentioned, majority are female. A third of caregivers are also caring for a child. They're part of the sandwich generation where they're caring for a spouse or a parent, but also a grandchild as well. And I think you've covered a lot of these pretty well, but I just wanted to kind of give a picture of who these caregivers are. So I ran across a couple of studies when researching this topic. The CDC analyzed subjective cognitive impairment in caregivers over the age of 45 from 2015 to 2019. This was an annual telephone survey, so they would call once a year to kind of check in, and they would look for that subjective cognitive impairment or decline. And this was defined as self-reported experience of worsening confusion or memory loss over the last year. So I want to point out they weren't being diagnosed with any cognitive impairment. This is what they were reporting back. It was concluded that 12.6% of unpaid caregivers had subjective cognitive decline versus 10% of non-caregivers. And while 2% may not seem like much of a difference, it accounts for tens of thousands of people. Caregivers with subjective cognitive decline were more likely to be employed to have that extra stressor, to be men aged 45 to 64 years, and have chronic health conditions as compared to the non-caregivers with the subjective cognitive decline. There were, a few, like I said, limitations, and a big one was that these were self-reported symptoms. Another study that I ran across, it's probably the first thing that you'll see if you Google, is a caregiver at an increased risk for developing dementia. So it's a study or paper called An Ironic Tragedy. Are spouses of persons with dementia at higher risk for dementia than spouses of persons without dementia? This is a paper from the Journal of American Geriatrics in 2010 that suggested that spouses of people with dementia were at a 6 times greater risk for developing a dementia. I think the incident dementia was 14.8% for spouses of people with dementia versus 10 for spouses of people without the dementia. And that risk did seem to increase the longer the spouse was dealing with dementia. Theories for this include a shared lifestyle, caregiver stress. They did identify a few risk factors associated with that decline. So obesity, increased depression, poor sleep quality, less social interaction, less physical activity, higher calorie and fat intake. I also want to point out there were several problems with this study too. So they really didn't define the caregiving role. They just kind of assumed that a spouse of the person with dementia was their primary caregiver. And as we know, that's, not always the case. When I did a little further digging, it was I actually saw where the study was based off of like one county in Utah. So a very low population. So I just wanted to point out this study. I think there's a lot more that we need to be doing in terms of research, but this is the first thing, at least for me when I was, just kind of Googling the article that came up. So I wanted to certainly address it. So our conclusion is that, there is an increased risk due to family history if the caregiver is related. And there could be an increased risk due to increased caregiver stress. While we don't know exactly why caregivers have more memory loss than non-caregivers, it could likely be due to all of the emotional, financial, and physical strains in their lives. Many caregivers are working, they're raising a family, and then they're caring for someone else as well. And while providing that care, like I mentioned, can be very fulfilling and meaningful, it can also be hard to balance with everything else, especially your own health. Caregivers being exposed to constant stress and not having the time to care for these risk factors really increases that risk. So I wanted to give a few stats about caregiver health in general. Nearly 75% of caregivers are concerned about maintaining their own health since becoming a caregiver. Over 1 in 3 caregivers say their health has gotten worse due to their care responsibilities. More than 25% of caregivers delay or do not do things they should do to maintain their own health because they're putting themselves on the back burner. And as many as 40% of family caregivers of people with dementia suffer from depression, just like Erin mentioned. And as we'll see, depression is its own risk factor for developing dementia. So, kind of want to change gears a bit. The Lancet Commission did a study in 2020, which identified 12 modifiable risk factors for dementia. These are things that we can change. And they came to the conclusion that up to 40% of dementia worldwide is preventable. I think the initial thought was, well, we are including developing countries who don't have, the same access to healthcare. And when they replicated studies in the United States, they came to similar conclusions. So, what are these modifiable risk factors? Less education, hearing loss, traumatic brain injury, hypertension or high blood pressure, excessive alcohol intake, obesity, smoking, depression, social isolation, physical inactivity, diabetes, and air pollution. This is just a nice little kind of visual of how these modifiable risk factors and non-modifiable risk factors affect us and at what point in life. So hopefully you guys can see the cursor, but at birth, those genetics play a factor. In early life, less education can be a risk factor. When we get to midlife, hearing loss, hypertension or high blood pressure, and obesity become things that can affect or increase the risk for developing dementia. And then in late life, things like smoking, depression, physical inactivity, social isolation, and diabetes can increase the risk for dementia. This is just another kind of visual that, if we minimize diabetes, we treat the hypertension or high blood pressure, we prevent head injury, we stop smoking, reduce air pollution, reduce midlife obesity, we maintain frequent exercise, reduce occurrence of depression, avoid excessive alcohol intake. We treat hearing impairment, maintain social contact, and if possible, attain a higher level of education, we'll see reduced neuropathological damage, increased and maintain cognitive reserve, and then that could help us prevent dementia. So there are several strategies for brain health and prevention. You have the vascular hypothesis. What's good for the heart is also good for the brain. You have the stress hypothesis, that stress can damage the brain. More robust social networks may actually help lower this risk. You have the cognitive reserve hypothesis, that mental and physical activity may build a cognitive reserve, and greater cognitive reserve may actually protect against dementia. And I wanted to take a second and define cognitive reserve. It's not necessarily a definition that you hear all the time. This is an idea that the brain has a reserve of thinking abilities that protects against the losses of disease and aging. To go a little further into the vascular hypothesis, cerebrovascular disease and atherosclerosis may promote the development of dementia directly or indirectly. So therefore, controlling the vascular risk factors may reduce the risk of developing dementia. This is an MRI of the brain of someone who has chronic small vessel ischemic changes, or you may see this as referred to white matter changes. I want to be clear. I see mild white matter changes on about 85 to 90% of patients in clinic every day. Oftentimes that can be associated with normal aging. What it represents is some plaque buildup in the small vessels of the head and neck. And again, if it's mild, it's probably not affecting things too much. It's pretty non-specific. But when those changes become moderate to severe, like you see on this MRI, that can really affect the memory and increase your risk for developing dementia. So looking at blood pressure and prevention, multiple studies have demonstrated an association between systolic blood pressure, that's the top number, and dementia. Possible mechanisms include damage to the blood vessels, direct toxicity to the neurons, and an impact on A beta or amyloid beta metabolism. So we're not able to clear those plaques out of the brain as well. Cholesterol and prevention. This probably is impacting the risk of developing dementia through atherosclerosis and cerebrovascular disease, but also may impact the way that we're able to clear the plaques from the brain. It also, if your cholesterol is pretty high for a long period of time, this may disrupt synaptic plasticity. That's a fancy term that just means that the neurons in the brain aren't able to send messages and communicate as effectively, therefore impacting function. So looking at statins and prevention. Statins is a class of medications that are used to lower cholesterol or treat high cholesterol. Several studies show a reduced risk for dementia among statin users. Possible mechanisms include the beneficial effects on lipid or fatty acid metabolism, atherosclerosis, and those amyloid plaques, the metabolism of those. However, clinical trials in patients with dementia have failed to show a benefit. So it seems like it's really more beneficial for prevention. Obesity and prevention. Approximately 70% of US residents are overweight or obese. More than half of US adults suffer from abdominal obesity. This is a fat buildup around the trunk of the body or abdomen. Abdominal obesity in particular is associated with an increased risk of dementia. This is partly explained by like associated cerebrovascular disease, diabetes, that's the DM, or pre-diabetes. But part of that risk is not explained by those factors. Diabetes, insulin resistance, and prevention. Diabetes has long been associated with an increased risk of dementia. This may be mediated through insulin resistance occurring years to decades before. Then looking at physical activity and prevention. Aerobic exercise has been associated with preservation or improvements in cognition. There is a Finnish from Finland study, CAIDE, CAIDE, a study that showed that regular physical activity and leisure time at middle age is associated with a 50% reduction of risk of developing dementia 20 years later. That's defined as anything over a brisk walk, 20 to 30 minutes, a few days a week, to where really we want it to be where you're breaking a sweat or you're a little short of breath. That effect may be even greater when combined with non-aerobic exercises. So we're thinking maybe strength training, yoga, things like that, about 2 to 3 times a week. In fact, exercise has resulted in less Alzheimer's disease pathology when we've studied it in animals. Benefits of physical activity include a 20 to 50% reduced risk of cardiovascular disease, 25% reduced risk of stroke, 20 to 30% reduced risk of diabetes, and a reduced risk of depression, which we know is a risk factor for developing dementia. So the benefits are very wide when it comes to increasing that physical activity. Diet and prevention. When we're looking at dietary fat, we see that saturated fatty acids are associated with an increased risk of dementia. Those are things found in butter or animal fats. Mono unsaturated fatty acids found in things like olive oil have been associated with a reduced cognitive decline. When we're looking at diet in particular, a big one is something that I always counsel people on, the Mediterranean diet. It's been around for a long time, and each year there's more and more research and evidence that shows even more benefits associated with it. So in general, the Mediterranean diet is associated with longer survival in general. Excuse me, a reduced risk of cardiovascular disease, a reduced incidence of cancer, and more recently, it's been associated with a lower risk of cognitive decline overall and a lower risk of Alzheimer's disease. What is the Mediterranean diet, you may ask? Primarily a plant-based diet, so you want to really focus on getting in foods like fruits and vegetables, whole grains, legumes like peas, beans, chickpeas, and nuts, as opposed to more processed foods. Excuse me. You want to replace butter with olive oil and canola oil when possible. You want to limit red meat consumption to a few times per month and eat fish and poultry at least twice a week. There's another diet that we'll counsel patients on too called the MIND diet. That stands for the Mediterranean Dash Intervention for Neurodegenerative Delay. So essentially, it's just the Mediterranean diet combined with the DASH. And limiting cheese, which would be a bit challenging, at least for me, but as well as limiting pastries, sweets, fried, and fast foods. This is just kind of a thing that lists everything out and has a little more information on the MIND diet. So getting to the finger model. This was a 2-year study with over 1,200 participants, also done in Finland, and they looked at 5 separate interventions. So healthy food, like we talked about, they followed the Nordic nutrition recommendations. This is based on the Mediterranean diet. One of the interventions was increasing physical activity. Another intervention was increasing mental stimulation that we haven't talked about necessarily as much. Evidence has shown that cognitive stimulation at any time in life reduces the risk of cognitive impairment and dementia, even in your 90s or beyond. We can strengthen our cognitive reserve at any age. And how do we do that? So education, things like your occupation and leisure activities all contribute to our cognitive health. Activities like playing games, attending courses, reading books, going to theaters or museums, and being active in associations all stimulate our brain. Things like puzzles, crosswords, and building things are also good day-to-day brain training. That's something I get a lot of questions on. The 4th intervention was increasing social activities. And the 5th was making sure to keep a check on those cardiovascular values, like we discussed, making sure blood pressure is well controlled, cholesterol, diabetes, those sorts of things. This is just kind of what I just talked about, and it lists the interventions. And it was shown that there was a significant benefit for the people who had or went through these interventions on their overall cognitive performance. So for prevention of dementia, there are no proven strategies so far, but there's increasing evidence that suggests that multiple interventions may be quite helpful. Current strategies are based on recognition of modifiable risk factors. So strategies for brain health, like we've talked, they're general health recommendations. So you want to be treating that diabetes and high blood pressure. Don't smoke as much as possible. Watch weight. Avoid head injury. Limit alcohol intake. Employing lifestyle strategies like making sure you're getting regular mental exercise, physical exercise, and regular social contact. You want to, as much as you can, maintain adequate sleep. So that's 7 or more hours a night. And then following a diet such as the Mediterranean diet or MIND diet are shown to promote brain health. Now, I say all of that, it's really not about perfection rather than it is about progress. It really helps to start small with something that you really want to do. Even little things like getting 1 or 2 more vegetables or fruits in a day, 30 more minutes of sleep a day, seeing your doctor once a year for a checkup, or walking around the block each day. That can make a huge difference in the long run. We only have one body and brain, and we need to care for them as much as we can. And that's where it's important to make sure that you're getting adequate support as that caregiver. It's so important to care for yourself. As I often tell patients, family or caregivers, you can't pour from an empty cup. And the evidence and really shows that the caregiver of the patient having enough support is as beneficial as the strongest medicine I can give the patient. It's really important at the end of the day. And I just wanted to end with a picture of my kiddos. And then we recently bought or got chicks and ducklings. So here's a picture with the ducklings. We couldn't wrangle all the chicks in the picture.